The U.S. Attorney's Office for the Southern District of New York, which encompasses the boroughs of Manhattan and the Bronx in New York City, along with Dutchess, Orange, Putnam, Rockland, Sullivan, and Westchester counties. The office prosecutes cases involving violations of federal laws, and represents the interests of the United States government and its agencies in criminal and civil matters. The office investigates and prosecutes a broad array of criminal conduct of every conceivable magnitude, even when the conduct arises in distant places. Today, the office is at the forefront of many important areas of criminal law enforcement, including terrorism, white-collar and cybercrime, mortgage fraud, public corruption, gang violence, organized crime, international narcotics trafficking and civil rights violations. Similarly, the office litigates among the most complex and significant civil cases the Department of Justice handles, from large affirmative civil fraud cases to cases in the environmental, healthcare, immigration, and bankruptcy areas, as well as cases implicating classified information.
June 26, 2024. Mom who slit children's throats and left them for dead on NYC sidewalk. Hit with 30 years to life sentence, day. A Bronx mom who killed her young son and left her daughter for dead on a sidewalk after slitting their throats was sentenced to decades behind bars, officials said Wednesday. Shanice Martin, 24, formerly of Seward Avenue in Castle Hill, will serve between 30 years to life in prison for killing 6-year-old Xavier Martin at the corner of Brook Avenue and Washington Avenue. On April 27, 2019, after a struggle with the little boy, Bronx's Darcel Clark said in a statement. That day, Martin attacked her boy with a box cutter, then turned on her 2-year-old daughter and sliced her throat and her side, Clark said. She left the grievously injured children on the sidewalk, laying in pools of their own blood. After the stomach-churning crimes, she walked to the 42nd Precinct station house covered in blood, with the blade still in hand, and told the cops what she'd done, police sources told the Post at the time. Go ahead and arrest me, she said, according to sources. Police charged Martin, a homeless woman with a litany of mental health problems and a history of child abuse, with a laundry list of crimes. They brought her to Lincoln Medical Center for a psychiatric evaluation. Meanwhile, the kids were brought to New York Presbyterian Hospital, where they were treated and eventually released. But nearly 2 months later, the boy collapsed in the cafeteria of PS/MS5 in Port Morris. As he stood on line for pizza, he passed out, witnesses said at the time, and blood and foam began to pour from his mouth. Investigators later ruled the death a homicide, with the city medical examiner saying he died of asphyxia due to obstruction of airway by laryngeal granuloma complicating incised wound of neck. The defendant committed an inexplicable act of cruelty and callousness against her own children, slashing them and leaving them on a street corner to die, Clark said in a Wednesday statement. A little boy is dead, and his sister survived the brutality but still suffers the effects. Martin was charged with second-degree murder and second-degree attempted murder, the DA said. June 26, 2024. Dengue fever cases prompt CDC health alert. See how many cases in New York. Over 100 cases of dengue virus infections have been reported in New York State so far this year. As the Centers for Disease Control and Prevention, CDC, issued an alert Tuesday over an increased risk of dengue virus infections in the U.S. Dengue fever, a viral infection transmitted by mosquitoes, has been reported in 43 states this year with a total of 2,241 cases nationwide. As of Wednesday, how many dengue fever cases have been reported in New York? New York currently has 134 reported cases, trailing only Puerto Rico, which has 1,498, and Florida with 197. All of the state's cases are travel-related. New York County and Kings County have the highest number of cases in the state with 39 and 22, respectively, according to CDC data. Here's a list of the counties with reported cases this year and how many they have so far. Allegheny, 1 to 4. Bronx, 9. Chenango, 1 to 4. Columbia, 1 to 4. Dutchess, 1 to 4. Erie, 1 to 4. Kings, 22. Nassau, 1 to 4. New York, 39. Onondaga, 1 to 4. Ontario, 1 to 4. Orange, 1 to 4. Queens, 18. Rockland, 1 to 4. Suffolk, 12. Tompkins, 1 to 4. Ulster, 1 to 4. Wayne, 1 to 4. Westchester, 11. Why did the CDC issue a health alert on dengue? The CDC said it issued the health alert to notify healthcare providers, public health authorities and the public of an increased risk of dengue virus infections in the U.S. in 2024. Global incidence of dengue in 2024 has been the highest on record for this calendar year. Many countries are reporting higher than usual dengue case numbers. In 2024, countries in the Americas have reported a record-breaking number of dengue cases, exceeding the highest number ever recorded in a single year, the CDC said. Lyme disease in New York. See rates in your county. From January 1 through June 24, 2024. Countries in the Americas reported more than 9.7 million dengue cases. Twice as many as in all of 2023, 4.6 million cases. In the United States, Puerto Rico has declared a public health emergency, 1,498 cases, and a higher than expected number of dengue cases have been identified among U.S. travelers, 745 cases. How do you get dengue? Dengue is a viral disease caused by any of 4 related viruses. According to the Centers for Disease Control, the dengue virus spreads from person to person through the bite from an infected Aedes aegypti or Aedes albopictus mosquito, which are not found naturally in New York State, according to the state's Department of Health. After a female mosquito bites a person infected with the dengue virus, there's an incubation period of 8 to 12 days. After that time, the mosquito can transmit the virus for the rest of their 1-month lifespan, the CDC said. Is dengue treatable? There are no antiviral medications approved to treat dengue, the CDC said. Treatment is supportive, when needed. What are the symptoms of dengue fever? The most common dengue symptom is a high fever of 104 degrees. And any of the following signs: headache, muscle, bone, or joint pain, nausea, vomiting, rash, pain behind the eyes, swollen glands. Mild symptoms of dengue can be confused with other illnesses that cause fever, the CDC said. Symptoms of dengue typically last 2 to 7 days and most people will recover after about a week. When should I seek emergency help? Severe dengue is a medical emergency, the CDC said. Warning signs usually begin in the 24 to 48 hours after your fever has gone away. About 1 in 20 people who get sick with dengue will develop severe dengue. Severe dengue can result in shock, internal bleeding, and death. A blood test is the only way to confirm the diagnosis. Untreated severe dengue fever may have a mortality rate of 10% to 20%. However, with appropriate supportive care, the mortality rate can be reduced to approximately 1%, the National Library of Medicine said. Go to a local clinic or emergency room if you have any of the following symptoms: belly pain or tenderness, vomiting, at least 3 times in 24 hours, bleeding from the nose or gums, vomiting blood, or blood in the stool, feeling extremely tired or restless. How to protect yourself against dengue? Since cases of dengue in New York are imported, the state's Department of Health says to minimize your exposure to mosquitoes. If you're planning to travel to an affected area, learn how to prevent mosquito bites. Use Environmental Protection Agency approved repellents during travel to end. After returning from areas with frequent or continuous dengue transmission, wear loose-fitting, long-sleeved shirts and pants tucked into socks or boots. The use of insect repellents may be helpful in minimizing your exposure.
Equality before the law, also known as equality under the law. Equality in the eyes of the law, legal equality, or legal egalitarianism, is the principle that all people must be equally protected by the law. The rule of law is a political ideal that all citizens and institutions within a country, state, or community are accountable to the same laws, including lawmakers and leaders. It is sometimes stated simply as no one is above the law.